Conger and Tori Sorensen share a special bond. Carrie helped save Tori's life after she collapsed while playing a game of intramural basketball at Gonzaga's Student Fitness Center.
I was playing basketball in the gym and I just collapsed. I had no idea that I was at any risk and suffered a cardiac arrest. And luckily, thankfully, CPR was started right away, and I'm here today because of that.
Fortunately, Carrie was close by and immediately started CPR.
Is this really happening? Is this really something I'm going to have to do? And, you know, time meaning milliseconds. All this stuff is flying through my head like, oh my gosh, really? And I just kept saying, oh, really, really? And honestly, I just kept asking myself that. And the time came when I just went, this is really what I need to do. I need to take over. I need to give CPR.
CPR was started right away, and once the EMT and medics got here, they shocked me 3 times with an AED, and I was rushed to Sacred Heart, where I was induced in a coma and given a hypothermic treatment, and I'm here. I'm alive.
Tori was one of the lucky ones. It is estimated that more than 95% of sudden cardiac arrest victims die before reaching the hospital, resulting in approximately 250,000 deaths each year in the U.S. Only 1 in 4 patients in cardiac arrest receives bystander CPR. If CPR is performed, you can double or triple a person's chance of survival.
What is going to make the biggest difference in terms of our improving survival in the city of Spokane and the county of Spokane is going to be immediate application of citizen CPR.
Fortunately, CPR has never been easier to learn or perform. New guidelines from the American Heart Association call for hands-only CPR or compression-only CPR.
It has significant benefits in a lot of ways. First of all, it's a much easier way to do CPR. So it's not that difficult to learn how to do it. You don't have to try to coordinate breaths and chest compressions, etc. The other thing is that large studies have been done that show that what causes people to be reticent about doing a resuscitation on a neighbor or loved one or someone who just goes down in the public is that folks are afraid of communicable diseases. They don't want to have to do mouth-to-mouth resuscitation. And in fact, that's part of what motivated a lot of the research that now has become the foundational science for good resuscitation.
If you witness someone collapse suddenly, have someone call 911 immediately or do it yourself. Rub their chest hard or shake the person and see if they respond. If there is no response, start CPR immediately. Don't waste time checking for a pulse. Position the patient with their back on the floor. Place the heel of one hand on the center of the chest between the nipples and the heel of the other hand on top of the first. Lock your elbows. Place your shoulders vertically above your hands and use the weight of your upper body to fall downward, compressing the chest 2 inches deep. Lift your hands slightly each time to allow the chest wall to recoil. Compress the chest at a rate of about 100 per minute.
So that's pretty fast, and it wears people out probably within about 2 minutes. What most studies show that people can do good CPR for about 2 minutes. After 2 minutes, it's important to switch providers. And when you do switch providers, it's very critically important that you don't have a prolonged pause. In fact, it would be best if there's no pause at all, because the perfusion of the brain and the heart is kind of a ramp-up phenomena. So it takes a while for you to actually get blood perfusing the heart and the brain. And if you stop at all, you lose the progress that you've made and you have to ramp up all over again. 100 per minute is the rate that is preferred, and it's difficult for some people to remember 100 per minute or figure out what that is unless they have a metronome. So what I usually say is sing the song by the Bee Gees, you know, da 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 da, staying alive. If you sing it at the rate that they sang it, then that pretty much will pace you at 100. The second piece that's important is that you have to get a good chest compression. What the studies have shown is 2 inches. That means you got to push down really hard. 2 inches is a long distance. The third important component is that you've got to get your hand completely off the chest. You've got to get full recoil. The reason why this is very important is because the compression phase is what perfuses the brain. But the release phase is what perfuses the coronary arteries of the heart, which makes it responsive to defibrillation. So I like to say to people, when you're doing chest compressions, you got to think brain, heart, brain, heart, brain, heart, and visualize that as you're doing it.
Hands-only CPR will not restart someone's heart. What you are doing by compressing the chest is keeping blood flowing to the heart and the brain until EMTs and paramedics from the Spokane Fire Department can arrive and defibrillate the patient.
If you look at the curves that have been established for people's survival in this setting, what you find is only about 10% of the people will survive if they get shocked at 8 minutes. But if good chest compressions are started right away when the person goes down, you can alter that death curve, if you will, significantly, such that people will respond to electricity for quite a bit longer. And in fact, at 8 minutes, if CPR is started immediately, at 8 minutes, we have more like a 40 to 50% chance of saving someone's life.
Hands-only CPR is easy to learn and easy to do.
100 per minute. Don't stop, press hard all the way up, and that's the important thing, and it's pretty simple.
Hands-only CPR is recommended for adults who suddenly collapse and are unresponsive. It is not recommended for children under 8, near-drowning victims, or cases of drug overdose. In those cases, use traditional CPR methods. For more information, visit our website at SpokaneFire.org.